for joining us. I'm John Paul. Hospitalizations in North Carolina have been climbing over the last week, reaching a new high today. That number reaching more than 1,000. Along with that, there are growing concerns about the hospital capacity right here in the Charlotte area. Our Joe Bruno is live for us tonight right outside of Novant Health. Now, Joe, are our hospitals prepared if these numbers keep climbing?
John, the good news is there's a lot of great doctors at places like Novant. They have a lot more experience with COVID and are able to treat people better. But still, capacity is filling up and leaders want people to take precautions.
We are particularly concerned about the Charlotte area and their hospital capacity.
Dr. Mandy Cohen with an ominous warning about the state of hospitalizations in North Carolina. She's keeping a close eye on the Queen City.
At this point, there is not a need for further intervention, but we will continue to reassess this decision. We don't want to be in a situation where we're nearing our ICU capacity, and we want to avoid a situation where hospitals are forced to postpone procedures or surgeries or other essential non-COVID care.
According to the latest data, there were 177 COVID-19 patients in Mecklenburg hospitals as of Sunday. Atrium and Novant are at 80% capacity and have 400 ventilators available. The county manager says our hospitals are in much better shape now than they were when the pandemic started. Doctors know more about coronavirus, how to treat patients, and how to create space in their hospitals. At one point, leaders were considering a field hospital at UNC Charlotte. At this time, no extra space like that is needed. Like everything coronavirus related, things can change quickly. The governor is begging people to not let their guard down.
It's good that we still have hospital and ICU bed capacity, but what we know is this: the disease continues to spread, and though North Carolina isn't a surging hotspot like some other states, we could be if we don't stay strong in our fight.
While we in North Carolina are not in dire straits like some around us, we have reason to be concerned and need to remain vigilant in slowing the spread of the virus.
Hospitalizations are a lagging indicator, so they really only look at this metric in certain circumstances. They don't base reopening decisions specifically on hospitalizations. They're also keeping in mind percent positivity rates as well as total new cases and the total number of cases of people going into the hospital with COVID-19 like syndromes. John?
And we keep track of that as well, the 7-day moving average, which is very important. Joe Bruno live for us tonight. And we want to go deeper into these numbers to see why there's concern about what's happening in the Charlotte area. So take a look at this. This is last month here. Across the state, hospitalizations up 33%. In Mecklenburg County over that time, look at the difference, 75% increase. Today, Atrium officials explained to us where that increase is coming from and how they're trying to change to keep up.
Some of the uptick in the recent number of cases is younger individuals. The people with the ICU stays and whatnot are still older individuals, people with multiple medical problems. That population hasn't really changed, but we are seeing more cases in, 20 to 40-year-olds, and our pediatric cases also have increased. Overall, our ICU volumes and ventilator volumes have been pretty darn stable over this, at least the past month or two. I think we're testing more and finding more cases. So that's part of it. We, for a time, so early on in COVID, we had opened up a virtual hospital that took care of sicker patients that maybe are on the verge of needing hospitalization. When things calmed down, we were not offering that, and now that it's opened up again, we're offering it again. So that helps offload some of those kind of regular hospitalizations.
And Dr. Pazzaretti says that Atrium is not testing every single patient. She estimates it's probably around 70 or 80% of the people who come in get a COVID test. She said, yes, it does add to the total number of cases, but it doesn't explain the overall rise in cases that we've been seeing.